My name is Abina Johnson, and this is Focus on Liberia. Hit it! From Cape Mount to Cape Palmer, Mount Nimba to Atlantic Ocean, Obomi Hills to Bokonjre, to educate, elevate, and promote. Yeah, focus on Liberia, for Liberia, Liberia, for Liberia, yeah, 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 yeah. From Monday to Sunday, from Monday to Sunday, it's focus on Liberia. Talk about home affairs, eh? In diaspora, current affairs, reliable information, history, talking about culture, politics, education, entertainment, business, sports, advertisement, articulation. Focus on Liberia. Focus on Liberia. Focus on Liberia.
At Focus on Liberia, we discuss everything Liberia, from education to politics, arts and culture, entertainment, agriculture, history, religion, family, and technology. Focus on Liberia uncovers and showcases the best of Liberia and shows the world the truth about Liberia. We educate, elevate, and promote all things Liberia. We conduct interviews, panel discussions, debates, and more. Tune in to Focus on Liberia on Facebook and YouTube and be a part of the stories that make up the news.
This is Focus on Liberia, and I am Dennis Ja.
And I am Asoni Sid. A pleasant welcome to Focus on Liberia. Thank you for joining us. Today is yet another informative edition of our programs here at Focus on Liberia. We have a guest in studio. It is a subject that is so important to our happiness and a subject that does not get that much attention from media folks. You know, health is everything. Someone said health is worth. If you are not healthy, you can't do anything. You cannot mean anything to yourself, let alone your family. We are here to talk about health, and we're talking health in Liberia. The topic for discussion: access to health care and quality care in Liberia. That is what we are here to discuss, and we try our best by finding somebody with expertise in the area of healthcare, quality healthcare. And he's here. He has accepted our invitation and is willing to share his knowledge, his expertise with us to understand the whole thing about how the healthcare system is in Liberia in terms of access and quality care. At this time, I will welcome my guest. He's Dr. Augustine Nyanku Jiraslonti Fannieh. Dad, welcome to Focus on Liberia. It's good to have you, sir.
Thank you very much. I'm happy to be on the show to discuss this very important issue concerning the health of Liberia. Thank you very much.
All right, that is good to have you, and thanks for making time to speak to us, our audience, and the Liberian people about the issue of healthcare in our country, Liberia. Dr. Fannieh wears many hats in his professional career. He's a medical doctor. He's a maternal health expert. He's a university lecturer. He's also an epidemiologist, and he's a biologist also. So it is good that we have you here. This is a field of study you have devoted so much time. But for the sake of our audience, some of them who may not, grasp clearly what all these terms mean, medical doctor, maternal health expert, university lecturer, epidemiologist. Tell us or tell them, what do you do? What is your profession here, sir?
Okay. Okay. For introduction, I am Dr. Agustin Yanko Jidas Fannieh.
Mhm.
Um, Being a biologist, me, I have a first degree in biology and chemistry from the University of Liberia.
Okay.
Then I went on to AMWT College of Medicine, did doctorate of medicine and surgery, and then went on to do maternal and child health at the University of Tokyo in Japan, and then health system management from the Maidol University in Thailand, and then applied epidemiology at the University of Liberia School of Public Health. Now, as a medical doctor, I've been involved with patient care for a long period of time. As a maternal and child health expert, I've been involved with the training and reduction in maternal and child deaths in Liberia, in places I've worked
Mhm.
in the country, developing strategies to reduce maternal and child death in some of the most difficult places I have worked in Liberia. And as a health system manager, also serving in various capacities in the counties under the Ministry of Health. Then I've been able to put into place some system issues, making sure that the system work, making it easy for people to have access to care. And as an applied epidemiologist, mean that we're able to watch disease trends, trend of diseases and epidemics in Liberia and see how we can develop strategies to control those different diseases that are occurring in the country. So those are the things that I do. Currently, I'm working up with GFK, John F. Kennedy Medical Center, as an epidemiologist in the Department of Community Health here at John F. Kennedy Medical Center, having worked in rural Liberia for a period of 9 to 10 years. Now I'm back in Monrovia, working at the John F. Kennedy Medical Center. Also, lecture at the University of Liberia, lecture in the Department of Biology, where I lecture senior courses in the biomedical pathway at the University of Liberia Department of Biology, and also at the AME University, where I also lecture senior courses at the Department of Biology also. So those are the things that I do.
Thank you for explaining that to our audience. And so, audience, you heard it for yourself. Dr. Fannieh has devoted himself to the field of study, medical science, health. So he comes with the expertise and is well placed with the authority to speak to us on, healthcare, access to healthcare in Liberia, and also talking about quality care here. So that let us get to it here quickly. Are you okay there?
Yeah, I'm okay. I'm listening.
Okay. I'm trying to get feedback, beginning to get feedback. That's why I was pausing. So let's talk about healthcare now in Liberia. And let's start with access to healthcare. Uh, from your experience and practice over the
Okay.
time in Liberia, what are the
Hello?
biggest? Yeah, can you hear me?
Hello?
Yeah, that I'm here. Can you hear me? All right, guys, bear with us there. We're gonna make adjustment. More than likely, my guests might have gotten a call. Maybe that disrupted the volume there. Dad, are you here with me? Okay, I can hear you. Can you hear me, Dad? That if you can hear me, can you just leave and come back in? Can you hear me now?
Hello?
Yeah, I can hear you. Can you hear me?
Hello?
Yeah, I can hear you. Can you hear me?
Hello?
It seems to be you're not hearing me. I can hear you, Dad. All right, Dad, can you log off and
Hello?
come back in? Yeah, he's not hearing me. Let me take him up. Maybe he will come back in. Folks, bear with us. Yeah, this is a very important subject. And many of us have heard stories about the huge, and mounting challenges in the healthcare system in Liberia. We heard stories from hospitals, and some of you might have your share of some of these stories that I'm trying to reference here. Dr. Fannieh, has been practicing in Liberia. You heard him. He works at the John F. Kennedy Medical Hospital, that is JFK. And he has also been teaching. He's also healthcare administrator. So he comes with the experience. He comes with the authority to actually be able to speak to us here when it comes to healthcare in Liberia. And we're not just talking just any care, we're talking about quality healthcare as well. He also explained that it's not that he only worked in Monrovia. He's been able to work in some of the counties. He's visited most of the counties. He's gone there and to do some work. He's gone to places and done some work. So he come with the requisite experience and expertise to really be able to explain to us. And one of the things that as an interviewer I have concern about is maternal health. We're talking about the number of women that are dying at childbirth or after childbirth. We have to talk about the maternal death. And so it's a huge thing, and the record, the rate of maternal death in Liberia, reports say is high, and it must be reduced. And so he has expertise in that. He's a maternal health expert. So, we all were given birth to by, our mothers, and here we are today. We are happy that those of us who are lucky enough to still have our mothers around. And the health of the mother also, during that period of carrying a child to childbirth and all that is very important, because we can't have a country where bringing forth the population for also increase the population is a problem. Then if that remains a problem, then we have to be alarmed at that. He has expertise in that, and I would like for him to also speak to that. Many things I have, and the access is another thing. Are there enough health centers, first of all, that people can go to? Is it possible? What is the distance some people have to cover before they can get to a healthcare facility, before they can get to, say, a clinic? And when they get there, do they have somebody there who can really give them care? And what kind of care is that person going to provide? Dad going to speak to us. Dad, can you hear me now?
Yeah, getting you. Sorry for the break-in.
Yeah. More than likely, maybe someone will have to call you, and usually,
phone game.
Me.
Okay. I'm trying to connect my
Mm-hmm.
computer, but it's kind of a little difficult. Okay, you were talking about access to care, right?
Yeah, I was talking about access to
health care in Liberia. Well, that can be looked at from a multifaceted perspective. All right. In Liberia, Yeah, almost 80% of our support to healthcare comes from our partners, our health partners. All right, as a country. Yeah, over the last 10 to 15 years, it's been like that. It's been like that. So there have been a lot of challenges with respect to access. According to our policy, if a health facility, public health facility or private health facility should be built at least 1 hour walk in between, which is 5 kilometers. All right, so that people in different areas, especially in our rural Liberia, we have access. We have access to those facilities. Unfortunately, it's not like that. Some of the facilities, some of the distances from where people live, especially in rural Liberia, to the healthcare facility, some people walk more than 5 kilometers. Some people walk 10, 15, 20 kilometers, 3, 4 hours to have access to care. Some of the places also, we have the issue of roads connectivity. All right. Some of the places, even motorbikes cannot go there. So for people to have access to care has been very difficult. So it's a multi-sectorial approach in the sector. It's not just a health sector issue. It should be engaged on a multi-sectorial approach. And we still having challenges with respect to access here in Liberia to healthcare. I will give you a few examples from my experience. All right. I used to work in Grand Crew County, where I come from. Between 2015 to 2019, I worked in Grand Crew County as a medical director at the Raleigh Hospital, and then later as the county health officer of Grand Crew County. Grand Crew County is one of the most, it's the rural of the rural communities or county in Liberia, and it's one of the most challenged county when it comes to rural connectivity and availability of health facilities at those various areas that they should be. All right. For example, there are communities in Grand Crew that are beyond rivers. And those rivers, you will spend maybe 4 or 5 hours to cross about 4 or 5 rivers to get to some of the communities. And those people practically will not have access to care adequately because of the distance. So the reason why I talk about multi-sectorial approach to this access to care, because it has to do with the coming together of not only the Ministry of Health, but the Ministry of Public Works, the Ministry of Finance and Development Planning. So it's a multi-sectorial approach to have access. So yes, access to care in Liberia is very limited because of some of these challenges I'm mentioning. Rural connectivity, distances from facility. Even when there is rural, the distances are so wide because it's no longer 5 kilometers, even though we have a program called the Community Health Program that have assigned community health assistants. These are local community dwellers that have been trained to carry healthcare services to children under 5 and refer pregnant women and other elderly to the facilities for treatment. But for example, if you have a community health assistant in the community that is 5, 6 hours from the health facility, even if that community health assistant encourage a pregnant woman to go to the facility, it would take her maybe 4 or 5 hours walk. She may not be able to go there because she will not be able to walk for the 4 or 5 hours. So we have a challenge. Access is limited to healthcare in Liberia, and it should be a multi-sectorial approach. All hands on deck. It is not only the Ministry of Health, it's all other ministries involved must get involved to make health accessible, affordable, and available to the population.
Thank you. That, myself, I am from Grand Crew. I live there. I visited almost every major town in Grand Cru, and I can imagine the distances we have to walk. So I can relate to that. Um, but you mentioned that the health sector, 80% of support have been coming from donor partners.
Yeah.
That is that a big problem?
Yes, it is. It's not just a big problem, but a very big one. According to WHO, a country budget should allocate at least 15% of the annual budget to health. At least 15%. That is at least 15%. All right. For the kind of challenges we are having in Liberia, 15% itself will not even be enough for the health sector in Liberia. So even though WHO put it at 15% of the annual budget, but in Liberia, I think we should put it at least 25% of the annual budget
And
towards
why
health.
you think the 15% will not be enough?
Because we have a lot of challenges. We have a lot of challenges. All right. WHO placed every health sector in the country under what we call the 6 building block of health system. And I want to talk about that a little as we go.
Yeah. Okay.
There are 6 building blocks of health system that WHO classify every country health sector to be able to meet. And based upon those things, it can tell the outside world whether we're making progress or we are still struggling with them, or we're making progress in some of them and still having challenges in some of them. The 6 building blocks of the health system include leadership and governance. Number 1. In a sector, there must be leadership and governance. In Liberia, I can say clearly that Liberia have done very well when it comes to leadership and governance, because there have been leadership into structure. When we talk about leadership and governance, we're talking about putting the different structure, policies, and strategies for the sector to move forward. And over the time, Liberia have been developing a lot of policies and strategies surrounding different aspects and areas of health delivery in Liberia. All right. We also have another block called the health workforce. Liberia have been having some challenges with respect to health workforce. The issue of quality or training health workforce to mend the health sector in all areas of the 15 sub-political division counties of the country and the 73 health districts. All right, the 173 health districts we have across the country. All right, we've been having issues with manpower to mend those areas. We've been having issues with staff retention at those different places. There have been a hard turnover of staff leaving their various places of assignment because of good incentives and all of that. So health workforce has been a challenge for us, and it's still a challenge for us as we work as a country to settle that. The issue of another, can I continue?
Yeah, go ahead.
Another block is the issue of essential medicine and technology. Most of our medication supplied to our public facilities across the country, about for example, about 60 to 70% of the provision of those quality of those drugs of essential medicine and technology at our different facilities have been provided by partners. All right. The government over time have been making a minimal contribution to the procurement of essential medicine and technology over time. And bulk of the supplies have been given to us by our partners. And we want to appreciate our partners for that. Now, we're having donor fatigue. USAID has shut down, Donald Trump has shut down USAID project, and it will have a serious implication on our health sector until the government of Liberia can step in and match up to what the partners were providing, which of course I think it will be difficult for the government to do. The government can do that, but it will be difficult because they might have other priorities that they want to focus on. But if we want to have access and quality care, these are the things we're going to look at. As another thing is health financing. We have a limited health financing project in Liberia. We don't have a national health insurance scheme. All right. Over the years, we've been discussing the issue of free care, free health care, or people who are working to pay for people who are not working to the health facilities. And the question that have come over the years to be able to solve or to answer is, what do we do with the poorest of the poor? Because in every society, there's poorest of the poor. Who takes care of that bill? And we're not able to answer that question over time. So there is no national health insurance policy, all right, that will cover health insurance for those who are working and those who are not working. And we look at the population pyramid of employment in Liberia. All right, the base of the pyramid is very big, and all those in our area, in our category, are people who are not working. So health financing become, all right, that's one. The issue of health information system is been supported by our partners. Yes, we are doing well with it and trying to maintain it, but again, it requires funding. So it's a serious challenge to us if the donor partner, 80% of our support to the sector is in the donor here. They are doing well, but now we see a regression. So it's very important for the government of Liberia to step up their game in providing that 80% that are being provided by our partners and donors in the health sector to be able to match. And that 15%, even though it's derivation standard, but 15% is not enough for Liberia because we have a lot of issues.
That you said it right. Yeah, you said it right.
Issues. If you want to provide health services, right now we have a facility. Let me give an example. We have a facility, health facility in Grand Group. I'm mentioning Grand Group because I work there. I work in other counties. I just give it Grand Group as a case study. Because most time in Monrovia, people have access to different facilities. They say, "Oh, we're doing well," but Monrovia is not Liberia. Most of our country is not Liberia. We have challenging conditions in rural counties. We have a facility in a place called Sobo in Grand Cru. To get to Sobo, you have to cross about 5 to 6 rivers. No car goes there. Nobody does not go there. You cross one river, you cross from Sassan to Betu, you walk and go across from Betu to Nifu. We have a facility in Nifu. You walk from there, you cross and go to Botra from there. So it's a long schedule. We have a lot of people, population in that area, and there are many other challenging areas in the other counties, other 14 counties. Even in rural Mosorado, there are challenging areas. No road network. So access to care or the provision for increasing and stepping up the health budget will be very good. While the health budget is being stepped up to provide essential care, public works and other sections of the country should also step up their game by providing the various things, the conduit for people to have access to care. So it's a serious challenge. Now you say it's out. All right. And what are we doing as a country, as a government, to be able to step up, put a lot of things in the budget to make up what you say was providing? It's a challenge.
Thank you. So I want you to help us.
Are you there?
With few of the things that you say.
Hello?
Yeah, can you hear me? I say I want you to help us.
Hello?
Yeah, Dad?
Yeah, okay.
Can you hear me now? Can you hear me? Yeah, so usually when someone calls, it can cause problem. Usually when someone calls, then that is a problem. Then he's not able to hear me. This is Focus on Liberia. I'm Anthony here. We are having a discussion with Dr. Fannieh. Dr. Fannieh is a medical doctor. He's a maternal health expert. He has worked in Liberia extensively. in rural Liberia, in JFK, and many other areas that he's worked. He also, healthcare, administrator. He has been able to work administratively also. So he has deep understanding and experience with all the challenges we go through in Liberia in the healthcare system. Bear with us. He will join by in. I wanted to ask him about what are the specific, things that USAID was providing as their contribution to the healthcare system before we had that technical issue there. He's back now, so just a moment here. He will be in here. Right, that usually when someone calls you, it will compromise the volume and you will not be able to hear me, but I could hear you.
Oh, okay. Okay.
So
I'm sorry for the
I'm trying
interference.
to ask you, now that USAID has left, can you explain to us what are the things USAID was paying for in Liberia? So as for us to get a grasp of the problem that is falling on us right now as a result of USAID leaving.
Okay, good. So USAID was involved with a lot of things with the health sector, a lot of things, service delivery to the provision of essential medicine. USAID were providing funding to procure medication, essential medicine and equipment for our health facilities. So that would be cut off. USAID were providing
health workers.
Come again?
Were they paying some of the health workers?
Not really. The health workers are being paid by the Ministry of Health. Mm-hmm. But in some instances, they were providing some top-up incentives for health services in various counties. All right. So they were providing funding to procure essential medicine for the country.
Okay.
All right. And when they procure the essential medicine, they were supporting other partners who would take care of the medication at the central medicine store.
Right.
For quantification and distribution that will reach to the last mile. Last mile meaning the last facility. All right. So it does not, the medication does not only sit at the county depot, but it's moved from the county depot to the facilities. They were providing funding for that. Mm-hmm. USAID were providing funding for capacity building, to build health workers' capacity in the area of service delivery. All right. Build a capacity in managing obstetric emergency to reduce maternal and newborn deaths. They are building capacity in nutrition, building capacity in expanded program immunization. Are we there?
I'm here, and you also mentioned you provide equipment for health workers.
They were providing some equipment for health facilities. I remember when I was in MyGibi, as a county health officer, MyGibi was being supported. MyGibi, along with 7 other counties, were being supported by USAID on the project called Health Partnership. All right, providing funding to support service delivery. And on that project, USAID provided because MyGibi, the hospital got burned, and the government was able to renovate another facility where we put in a theater, but USAID was able to provide the equipment for that operating theater. USAID was able to provide equipment for the setup of the neonatal intensive care unit at that facility. So it's not only in MyGibi, but many other counties. All right. USAID was also supporting the National Community Health Assistance Program, where we have community health service supervisor and community health assistant, local individual in their various communities that were being paid through donor funding, to bring or to refer pregnant women and children under 5 that are not well or need to attend ANC, antenatal care visit, to prepare them for institutional delivery. All right.
So
there are multi areas. Yeah.
I want to know now, with all of what you explained, how will you rate the overall quality of healthcare in Liberia, and what are the main areas that need improvement for the world quality, for quality healthcare to be achieved?
So if I was grading quality healthcare in Liberia, and the rate of 1 to 10, and 10 is the highest, I will put Liberia, for my experience, I'll put Liberia at 4.
Wow.
Yes. And I like to be very frank about why I put Liberia at 4.
Mm-hmm.
Because in this country, people only see that people are having access to quality care when they are in Monrovia. But Monrovia, like I always say, when I have the opportunity to discuss quality care, Monrovia is not Liberia. All right. We have bulk of our population outside Monrovia. And those population are having difficulties in having access to care. Some of our facilities outside of Monrovia, even in Monrovia, the various technology needed, for example, in diagnostic services, all right, imaging services, quote unquote diagnostic, laboratory and imaging. Even in Monrovia, we are having challenge with those things being provided. So those will affect quality. Those things will affect quality. Then if you go outside of Monrovia, it's even worse. Because outside of Monrovia, public facility, private facilities are still being challenged with respect to having those bare minimum things that should be available to provide the kind of care needed for our patients.
So in the rural areas, for example, give me a picture of the most challenged medical facility you visited, and tell us what are the things that were completely lacking.
Okay, so I will talk about 2 counties that I work, because I want to talk about places that I've worked.
Yeah.
All right, and it reflects the entire rural area, because the conditions are the same as you move from one county to another. The conditions are similar, because we meet and we have discussions, and what I'm talking about, other people from the other counties are also saying, and it's the same. And, it's similar all around. Okay, so I'll talk a little about Grand Crew. Let's move to Grand Gide. I worked in Grand Gide for 3 years.
Okay.
I worked there as the county health officer. The county health officer in Liberia is the head of the health system in the county. He regulates all health activities in the county. So it is his responsibility, his or her responsibility, to understand what are the challenges or the progress being made in health services or healthcare delivery services in the county. So in Grand Gide, for example, where I worked between 2019 to 2021, we have a county referral hospital, it's a secondary facility.
Yeah. Okay.
All right. It's a secondary facility. In Liberia, we have 3 tiers of our health sector. We have primary, secondary, and tertiary. The primary are the clinics, the peripheral clinics and things. Secondary are the county hospitals, some comprehensive health centers that have operating theater attached to them. We consider them as secondary facilities. And then tertiary are the big ones like JFK, Jackson F. Doe, all right, where you have some specialists and major things going on now. Yeah. So at Martha Tubman Memorial Hospital in Grand Gide, Firstly, the hospital itself is small. Thanks to the German government, now they are building a new facility. I initiated that project before I left Grangide. They are building a 120 bedroom hospital in Zwedru. All right. Thanks to the German government, partnering with the government of Liberia through the Ministry of Health. And thanks to them, when that facility is completed, it will do a good lot. But at Mother taught me, the challenges at Mother taught me, number one, has to do with staffing. Because a rural place, people go there to work, nurses, even doctors, nurses, midwife doctors. They go there to work. After working maybe for a year or two, maybe they leave Monrovia, go to work. After working for a year or 2 or 3 maximum, some people go up to 4 or 5 years. They start to talk about, oh, I want to come to town. I want to improve myself. So we have started an issue of staff retention. There is no extra incentives for health workers that move outside of Monrovia. So somebody, a nurse in Grangide is making, for example, $150 or $175 as a net salary. All right. And a nurse in Monrovia is also making the same $175 as a net salary. But the nurse in Grangide, in Mother Tubman, cannot work to any other facility besides Mother Tubman because it's a rural setting. All the other, most of the facilities that are there are public facilities. Are you following me?
I'm following you, Dan.
So the nurse in Monrovia may be working, for example, at JFK, and also have the opportunity to work to Catholic Hospital too, or work to ERW Hospital, or work to Jamale, or work to some of the bigger private facilities we have in Monrovia. And by that, they will be able to put a little together from this side to this side and take care of their families. And they're not going to be supporting 2 homes because they're already in Monrovia. But if a nurse leaves Monrovia and go to Grangide, he or she leaves his or her family in Monrovia that he has to support, and then have to support herself or himself in Zwedru while working at Mother Tubman and making a maximum of $150. Obviously, there will be a problem.
No doubt.
So that's one. 2, some of the equipments that are needed in Mother Tubman Hospital, I just using Mother Tubman as a template. All right, will not be available. For example, there's a time I was working in Grangide. I had this case of a young man who had a car accident on the highway between Zwedru and Kanweke, broke his ribs, and he started bleeding in the chest. They brought him to Zwedru, to Mother Tubman Hospital. Going into shock, bleeding profusely, ribs are broken. And then they call me as the county health officer, oh, we have an emergency. When they examine him, sticking a needle and drew blood. We don't have chest tube in Zwedru. So I had to improvise to save that young man's life for at least a day before to get him on a flight to transport him, to fly into Monrovia, to come to JFK to get special treatment that he needed to have his life saved. So I took him to the theater, got the tube that we can use for the suctioning machine,
right?
Inserted it, attached a man-made jar to collect blood in it, just to save his life. And by the grace of God, he became stable. We drained the blood. While he's draining, he was stable, putting antibiotics. And then the next day, we were able to get him on the flight when you're working for a company, they want to get him on the flight to fly into Monrovia. But there may be people who are not working for any company.
Yeah.
Do not have the money to get on flight. What become of them? Those things are not available. The basic equipments needed. There were times where we had to come to Monrovia to get anesthetic drugs, to procure anesthetic drugs and take it to the county, because those drugs are not available most of the time. The drugs that are supplied by the Ministry of Health to the Central Medicine Store, most of the time anesthetic drugs are not part of it. So the hospital will have to buy it. And at that time, we're giving, up to now, we're still giving free services. I understand they are working on revolving drug fund. We've been discussing revolving drug fund or fee for service over the last 6 to 8 years now. You still have, now we're not ready to come to a clear terms with that. But those are the challenges we have it.
So, Dad,
all right. Yeah.
The final thing I wanted to talk about maternal health and the ratio of patient to doctor, and also the ratio of patient to nurse. Talk to us about those three things.
Okay, so to begin with that, maternal health has been a major challenge, but the Ministry of the government of Liberia, through the Ministry of Health and the health facilities, we have made at least a little progress.
Okay.
All right. It used to be the rate used to be 1,072. All right. Over the last 4, 5, 6 years now, you have dropped to 748 per 10,000 live birth.
That is stay high.
All right. It stay high because according to the Sustainable Development Goal, it's going to be at 70 per 10,000 before 2030. That's the target for SDG number 3. They stay high. Liberia still has the worst, even though we are not the worst, but we still have the worst. This is even worse than us. I know, but maternal issue has been a challenge and still is. It still is a challenge here in this country. All right. And again, there are many things. There are many things that are responsible. As a country, are we doing our best? Yeah, we're trying, but there are a lot of things still need to be put into place. All right. I've mentioned to you the multi-sectoral approach.
Right.
You have a pregnant woman. When I was in Grand Cru, before I went to Grand Cru, the data showed that there was a lot of maternal death in Grand Cru. When I went, some of the strategy were put into place where the pregnant women that were near delivery, around 7 months or so, 7 to 9 months, that were beyond the rivers, we had to put into place a strategy to move them to Sastan. From beyond the people who know Liberia or know Grand Cru, we moved them to Sastan. We had to even rent a house because there was no maternal waiting room there at Sastan. We had to rent a house, place them in it, feed them, and make sure that they go through institutional delivery in the facility, Sastan Comprehensive Health Center there. Those ones that could not deliver by themselves, we did surgery on them to save them. All right, just to reduce maternal death. So it's a multifactorial issue that we have to handle. Okay, the major cause of maternal mortality in Liberia is postpartum hemorrhage. Postpartum hemorrhage means a woman deliver or they did operation and she still bleeding. All right, we have been challenged with that because of many reasons. Across the country, some of our secondary facilities across the country, there is no blood bank. If a woman is bleeding, she comes to the hospital, you have to give her blood. No blood bank. No blood safety, blood storage facilities. To many of our facilities. How do you do that? Even if you have somebody to donate the blood, the reagents needed in the laboratory to be able to screen that person to know that the person is free from all communicable diseases before bleeding the person to get the blood, some of those things are not available.
So let's go to doctor and patient ratio and nurse and patient ratio.
So WHO standard is 1 doctor to 1,000 patients.
Is it across the world or the Labrador standard?
No, that's WHO standard for the world.
Okay.
That's WHO standard. At least 1,000 patients to a doctor. That's WHO benchmark. It can be less than that in other well-developed countries, less than that. But that's the standard. WHO took into consideration the different continents and the challenges they're having with trained manpower and all of that. In Liberia, about 6 to 10 years ago, it used to be 1 doctor to 20,000 patients.
Whoa.
Yes. Seriously. Now, the recent statistics shows that we have now 1 doctor to 5,000 patients, which is still high.
And how many doctors do we have in Liberia? I'm just curious.
Well, according to the statistics, we should be above 300 now. The ministry, the medical school, the MWT have graduated a lot of doctors in the last 5 years. And, yeah, we should be more than 300 now, but more than 300 to 5.2 million plus population is still nothing. It's still nothing. All right. For nurse to patient ratio, I do not know. Only I check the actual WHO standard, but in Liberia it stay high. In Liberia it stay high. It stay high. The patient to nurse ratio, because in our facility, the nurses and the midwives are the ones who have access, who stay with the patient more than us as doctors. So if you have a nurse in a facility that is assigned in a facility in a particular area that have about 19 to 20 critical patients, and you have 1 nurse, that nurse will not be effective. The mortality rate will increase because 1 nurse cannot attend to 19 to 20 critical patients. Even if the patients are not critical, 1 nurse will not be able to attend to 19 to 20 patients at a time. Well, we have a lot of pre-service training, nursing, midwifery training institutions in the country, but then government is the biggest employer, and the Ministry of Health will not be able to absorb everybody coming from those pre-service training. We do not have many private standardized health facilities across the country or concession areas that will be able to absorb these trained paramedics or nurses, midwives, and other people that are coming from school to be deployed. Everybody running to the Ministry of Health to be employed. Everybody running to the government of Liberia, Ministry of Health to be employed. It's not possible for the Ministry of Health to employ everybody. Also, there are gaps in the public health sectors that people need to be employed, but then the envelope for the Ministry of Health is so small. So if the government gave 15% of the annual budget to the Ministry of Health, out of that 15%, about 12%, 10 to 11% or 12% will go towards salaries and incentives. So the other 3%, what can they do? And we have more than 933 public health facilities across the country.
So that, given the challenges that you explained, the country faces, my final question now to you: let's treat the overall Liberian population as your patient, and you should give this patient your expert advice with respect to their bad behavior in terms of their health, things that they do probably that may pose risk to themselves, preventive care. And I'm asking this question, my final question, because you mentioned the issue of access, and then the challenges with quality. So people need to be more preventive and avoid certain habits and stay away from some beliefs that may be harmful to their health. So you are the doctor to this big patient called Liberians. Advise us what to do.
Good. Thank you very much for the question. So, I will talk about a few of the things my advice on prevention that I'm talking about. I know I'm writing.
Yeah.
Anthony, I'm writing 3. I started writing. I'm on my 3rd book now. I say I want to see I can publish 3 of them together.
Oh, wow. Congratulations.
All right. Yes. One of them is on the epidemic preparedness of the health sector in Liberia, to see how prepared we are after we suffer Ebola and COVID. How prepared are we stay as a sector to address epidemics that will arise in our country? One of them. Another one has to do with pragmatic strategies for maternal and neonatal health in Liberia. All right, from my experience and all of that, another book title. The 3rd one is concerning what you just mentioned. On Liberians have a poor health-seeking behavior. All right, and that under that caption, writing a book called "Chasing Wellness: The Struggles of Liberians in Pursuit of Health," unveiling the complexity of health-seeking behaviors in Liberia.
Okay.
Yes, in that book, I'm talking about, I'm creating the awareness about Liberians leaving or desisting from that poor health-seeking behavior, number 1. Because in Liberia, people get sick, they go to the market, they buy to any pharmacy and buy medicine and take it. I'm also talking about how some diseases and conditions can be preventable. The people that say prevention is better than cure.
Yeah.
All right. Like now in Liberia, according to statistics, we have a high increase of non-communicable diseases: pressure, high blood pressure, diabetes, cancer, asthma. These things are increasing. All right. But it can be prevented. All right. So under prevention, talking to my patient Liberia, Liberia needs to actually gravitate more towards prevention than cure. Because when it comes to curative medicine, our ability is limited in the sense of all of the things needed to solve some of the problem. So it's better we go for prevention. People in the street walking, for example, you see even the issue of health and hygiene.
Yeah.
Basic personal hygiene is difficult for Liberians to follow that. Somebody's sick, they go to the hospital, they are treated, all right? And then they don't even complete the medication. They take it 1 or 2 days, they start getting well, they say, well, okay, now we'll keep it. The next time I get that same problem, I will not go to the hospital again. I will just take it. And while they are keeping it, their friend come to them and say, oh, I'm sick. I get this. But the same thing that happened to me yesterday. I went to the hospital to give me the medicine. I was taking it, but I get some here. Let me give it to you so you can take it. How do you know that the same problem you had that what your friend had? All right. So Liberia, we have a poor health-seeking behavior. It has become complex. Complex in a sense that, Anthony, the regulation of drugs, people selling over-the-counter drugs all over the place, in buckets, on the market table, even in drugstores and medicine stores and pharmacy. The people who are even selling some of the drugs, they are not health practitioners. They were just hired and say somebody can't want paracetamol, get in this. Somebody say they can't want infection medicine, get in this. So it's a complex issue. And we're involved.
I think you were about to mention hygiene. I want you to speak to that because we see the pollution, we see the filth everywhere.
Yeah. So in hygiene, in health and hygiene we don't even have a stable pipe-borne running water. If we take a visit now to the water company that are producing what we call quote unquote mineral water here, and you take a sample of that water and go to the lab, you'll be surprised to see the number of macros that are in the water. So even the very place they're producing the water, there is a complete weakness, all right, laissez-faire attitude on monitoring, evaluation, and making sure that people are adhere to standards. All right. Our donor provide mosquito net to us. Say, oh, take the mosquito net free, sleep on the mosquito net to prevent malaria. We take the mosquito net, we make basket with it. Some people put it behind their GoPro as net. Some people put it around their garden. The reason why I saw now, some people take it and they make decoration with it and put on the car for wedding. So adherence to practices, hygiene practices, all right? In our streets, we see sewage pipes burst and you have feces oozing from all of the places. That is health hazard to many places. So if we can just think about hygiene, all right? I don't want to mention the BB1 like environmental pollution, all of that, but the basic ones. Cleanliness, people cleaning their houses, and separating waste, putting it where they should be, not just chunking waste in the street, and all of that, making sure that things are okay. It will help to prevent a lot of things. All right. So those are areas, my brother. In Liberia, we have a poor health-seeking behavior. There have been awareness on the radio from the ministry. I must admit, there have been series of awareness on the radio. Everybody can listen to the radio anyway. Yeah. Even at the level of the community, our community health assistants have been carrying on those awareness at the community level, but people are just bent on poor health-seeking behavior. So it's a behavioral problem. We need behavioral change in the life of Liberians to address some of these areas.
We want to say a big thank you to you, Dr. Augustine Nyakun Girasnonti Fannieh, for taking your time and sharing with us your expertise, your understanding, and listing the challenges when it comes to access to healthcare, quality, all of the things that are making it nearly impossible for Liberians to have access to care and the quality of it. Thank you so very much. We will give you the opportunity to give your parting statement. Thank you, and we appreciate you honoring our invitation.
Thank you. Let me say thank you. Is it that StreamYard, StreamYard Studio?
Yeah.
Yeah. Let me say a big thank you to Anthony and your team at StreamYard Studio. I'm very humble to be part of your show, and
our platform is focused on Liberia.
Okay, focus on Liberia. Yeah. I want to say a big thank you to the platform Focus on Liberia, and I'm happy and humble to be on your show. And I hope some of the things that we've discussed, that it will reach far and wide, so that our authorities in the country will be able to pay heed to it, especially the policy makers will pay heed to it. We have a population of 5.2 million plus to protect. A healthy nation is a wealthy nation. If you're not healthy, you cannot do anything. So in addition to other things we talk about, even though no time now to talk about that, maybe another time.
Right.
We need to look at the social determinant of health. That Liberia, we are lacking behind when it comes to addressing the social determinant of health, and all of those things tie into the 6 building block of the health system of the WHO, the social determinant of health, meeting the sustainable development goal number 3 on health and well-being. All of that will help to make Liberia a healthy and a wealthy nation. We look forward to that, and we hope our policy makers, our government in power, government in present, and want to come, will focus on improving the health quality of the people of Liberia. Thank you very much, and I'm humbled to be on your show.
Thank you, Dad. We will not hesitate to reach out to you another time to have the conversation going. We appreciate you, sir.
Thank you so much.
All right. Bye-bye.
We are Liberia. Liberia is our home. Liberia people. Either you raise it or we want. Liberia. Either you raise it or we want. Liberia, Liberia. Oh,